I would like to welcome to the stage, please, Anish, Sebastian, Dr. Lauren Demosthenes, and Grace Balding, and her kiddo, Aiden, to the stage. Please welcome them up. We are really excited to be able to have them. We seem to be missing a chair, but that's okay. We're going to keep standing. We'd like to make Aiden feel really comfortable. So for those of you who have kids, you may know a little bit of that baby rock, and we're going to do it to a really special song for Aiden. So please stand up. Make Aiden feel really comfortable on the stage.
Get that blood flowing.
We had to get that energy flowing. Hey kiddo, this is your first time on stage. You're the youngest person we've had upon the stage for this festival, and we're so excited to have you on here. So everyone, please give Aiden a really gentle applause, and let's take our seats. Okay, so I am very excited to be able to speak with you guys today. But first and foremost, for those who may not know too much about pregnancy and obstetrics, Dr. Demosthenes, I'd like to turn to you first. And if you could just paint the picture, give us the context of what is it like to manage pregnancies in the U.S.?
Sure. So historically, we have patients come in between 10 and 12, 14 visits for their pregnancy, but when you look back to try to find out where that started, it started historically because we were really concerned about having women come in to check their blood pressure. And in this day and age, when you start looking at why do we do what we do, you realize, there are better ways to do it. And scientifically, there's no reason that patients need to come in that many times. The quality of care, the outcomes are all similar if they have at least 5 to 8 pregnancies. What's missing, though, is the connection. So women who are pregnant don't want to go that long span without some sort of contact, but it doesn't need to be in person. It can be text message, it can be phone call, just some way to stay connected. Where I work at Prisma Health, we really, really want to focus on offering choice to our patients. So we decided to partner with Babyscripts to give that as an option to pregnant women who may not want the traditional 12 to 14 visits. So that's how we started.
Thank you so much for giving us that context. Now, Anish, knowing what is going on within the landscape, the fact that it is 12 or 13 or 14 visits, it doesn't seem like it's standard. How did you find that out and launch Babyscripts to be able to address that challenge?
Yeah, if you look at pregnant moms, they typically tend to be between the ages of 18 to 35. So from our standpoint, they are an absolutely perfect demographic to adopt and, to be honest, be on the cutting edge of the use of digital technologies. So we thought, why not use smartphones, connected devices, big data as a great way to engage these moms, empower them. And oh, by the way, for about 70% of pregnancies out there really should not be an ICD-10 code. This is not a medical condition for a lot of moms out there. So to the extent that we can empower and engage these moms, it's a good thing, and allow our providers like Lauren here to really focus her attention and spend time on the moms that truly need the attention.
So, Aiden, how did it feel using the Babyscripts app? I'm kidding. Grace, if you
Just give him a few more days.
Yeah, we'll give him a couple. Grace, can you please share with us your experience? Because Aiden is your second son, if I understand, right?
Yes, Aiden is our second son. He's almost 4 months old, and we have a 2-year-old at home. Yes, so I was pregnant with Aiden when I used the Babyscripts app, and William was about 1, and so he was already turning into a very busy toddler, and when you have a toddler at home, you just don't want to get in the car all the time. So it was really, really nice just finding out, oh, there's an app I can put my blood pressure data in, because that was going to be a routine, again, with my second pregnancy, which I was very excited about having another baby. But blood pressure and weight, you could just put it right into that Babyscripts app.
How did you come into contact with the Babyscripts app? Did you find it online, or was it suggested by your practitioner?
One of my friends told me about it because we saw the same provider.
And so how did the experience kind of come about? So how did you get onboarded onto the platform? What was your experience like?
So I went to the doctor and I told them, I want to use Babyscripts. Can you set me up? And they immediately after my appointment with them, they sent me a blood pressure mommy kit through the mail, and it's Bluetooth to my cell phone, so I've got a cell phone, check, got a blood pressure monitor, and then they sent me, I also have a balance scale, everyone's got a weight scale, so they told me how to use the app, which was very easy, and I began using it and still had appointments to go to, but I had a few less, which was very nice.
Yeah, and so what was the experience and the difference between baby number 1 and baby number 2 outside of the appointments and your time being saved?
It really wasn't that different. I mean,
Great.
both pregnancies are pretty similar. I still had to go to the appointments for both of them, but it was just nice knowing that I could cut out 2 or 3, because to some people it might not seem like a big deal or a big thing to cut out a few appointments, but to a mom of a 1-year-old, it's a pretty big deal. So I was really, really glad to see that. So it wasn't a huge difference, because I still was able to see my doctors, talk to them about how I was doing, but I wasn't high risk, so my condition was fine, and I liked being able to see my own blood pressure data and my own weight data, so that was really nice.
And Dr. Demosthenes, so for a patient like Grace, who is lucky to have a low-risk pregnancy, how important is it to involve technology in cases like that?
So when you think about the number of women who are working now, sometimes it takes half a day off of work to drive to the physician, park, wait. And typically the amount of time we spend with a return OB can be really as short as 5 to 10 minutes. So being able to kind of combine technology with in-person visits makes so much sense. As Grace mentioned, she was able to see her blood pressures really as often as she wanted, so she knew what we were tracking. I'm really excited about empowering women to participate in their care. So I think it's just a natural progression. We have physicians, nurses, lawyers, engineers, teachers, all who have to take time off of work to come to appointments. So if we can streamline their pregnancies and reduce visits, we can reduce them really probably safely to 8 visits, which is really opens up time for the caregiver, physician, midwife to see other patients, and also it saves the patient an enormous amount of time, which is very valuable to them.
Both of you have mentioned the notion of connection and the fact that connection is still existed when, even though those few visits were taken out. Can you share a little bit about how you felt connected, Dr. Demosthenes, to your patients and Grace to your practitioner?
I felt the same connection, so it was the same.
Great.
The other thing that Babyscripts does is through the text messages, it allows you to feel that connection. So I think that as long as you're not just going 4 weeks without any connection whatsoever, even a text message makes you feel connected. I was talking in the green room. All of my children live very far away, and just to have a connection through a text message really makes all the difference in the world. And that's what Babyscripts does as well.
Yeah, and I think just to kind of add to what people are saying here, I mean, I think in every other transaction or any other interaction, digital is sort of the norm, right? Yep. If you're booking a ticket, if you're making a reservation, I mean, I booked an Airbnb, took an Uber, and got DoorDash. It's all in like 10 minutes or so, right? So why is prenatal care any different, right? Why is a lot of healthcare any different than that? So the notion of using smartphones, connected devices, just to make life a little easier, to me is common sense.
Yeah, and as you were developing the platform, Anish, how did you think about the notion of engagement and to making sure that both expectant moms and their providers were also staying engaged with the information, but also maybe not having too much overload of information, because that can happen as well?
That's a really good question, and I think it's really important as entrepreneurs developing digital health tools that we consider the workflow and the providers as a really important element here, right? I think we all know that one more thing to do in the EMR, one more checklist to check on is problematic, right? So I think a lot of what we focus our time on is how do we build an exception management system to highlight items that need urgent attention, but then if things are in the clear, in the green zone, continue the reinforcement to the patient, but not necessarily have that as something that requires urgent attention on the provider side, right? So there is this delicate balance that you have to sort of build in, and then of course, how do we do all the work that's needed to integrate into all the various systems is the other piece of it. So I think that's an important piece of what we're building.
So we mentioned earlier that you're managing 200,000 pregnancies, I believe, across 24 states, so about half the country. How do you think about expansion and reach, and continue to make sure that expectant moms like Grace have a wonderful experience with their pregnancy?
Yeah, I think, obviously we have a great kind of foothold right now. Our goal is to continue that, expand. Again, always keeping the provider in mind, right? So we're not planning on going direct to consumer anytime soon. But of course, Grace's case is an uncomplicated low-risk pregnancy. Not all moms are as fortunate. For us, it's really important that we start to focus on higher risk cases of pregnancy. We're doing some really good work right now on the postpartum time period, which I think is a huge gap, perhaps one of the biggest gap in all of healthcare, not just maternal health. So yeah, we're doing a lot of work there, particularly focusing on postpartum hypertension. We have a partner with we have a great partner in UPenn doing some great work there. So.
Great. So I want to actually pause on that and come back to that in just a second, because this is a little bit of a dual side network, right? You have to engage the expectant moms, but also engage the providers. Dr. Demosthenes, how do you talk to the providers that you work with within Prisma to encourage them to embrace technology at a time when maybe they may not necessarily be used to it?
I think what I've learned is it's very successful to pilot with a couple groups and show success. So we were able to show early success with our midwife group and then one of our private groups that Grace attended. And so we were really able to concentrate on those groups, prove success, gather some patient stories of satisfaction and happiness and word of mouth. What we're really excited about now is also to show the providers, again, the gap in the postpartum space. The American College of OBGYN recognizes that maternal mortality and morbidity is not in a good place in our country, and a lot of it takes place in the postpartum. So we see some opportunities to do postpartum depression screening. Anish will talk a little bit about the hypertension work, but the American College of OBGYN has expanded recommendations for postpartum blood pressure monitoring. We really don't want to bring those patients back in physically to recheck blood pressures. They're exhausted. They're not in a good place to be able to do that. But to be able to ask a patient to do a blood pressure from home, and me as a provider monitor that and intervene and treat without the patient having to come in or without the patient getting too sick. It's just, the sky's the limit on what we can actually do with it if we just keep our minds open and work with the startups to help develop, because we want our voice to be heard and we want the patient's voice to be heard. So I don't know if that's what you asked, but that was...
It's where I was actually going to go, because I think as entrepreneurs, you tend to go after a really tough challenge, but you have to start somewhere. And Grace, in your case, you're lucky to have been a lower risk patient, or lower risk pregnancy rather, and as many moms are, but not a lot will find themselves in that low risk camp. So. Postpartum, you said depression and hypertension. What are some of the other ways in which you are trying to make pregnancies better for all moms out there?
Yeah, and first let me just reemphasize that I think in America, we do a pretty terrible job of taking care of our moms. So I think we should all sort of sit with that fact for a couple of seconds. If you look at stuff like maternal morbidity and mortality, it's on the rise. And it really shouldn't happen here. I think
on the rise today.
Yeah, it's on the yeah, exactly. I think we're one of the highest of any advanced nation. So again, a lot to be desired there. And I think to the extent that technology can help with some of this, not be a silver bullet, it's a good thing. When you start looking at high risk, categories of hypertension in pregnancy is important. If you're diabetic and you get pregnant, that's high risk. But again, the goal for us is to avoid bad outcomes, right, and improve the quality of care. And I alluded to this earlier, but the first 14 days after a mom gets discharged ends up becoming a really important time period for really good care. And we could do a lot better as a country, as a nation, as healthcare systems, as individuals, to take care of our moms better there. So.
Grace, in your time in using the Babyscripts app, did you feel taken care of and that you were supported during the entire journey?
Definitely. I didn't see any connections severed, and I liked having the data in front of me all the time if I wanted to see my blood pressure go up or down, even my weight too. So it was just nice being able to take control of my health a little bit.
So as a second-time mom, you've been through it, so you're an expert at this point. What would you like to tell first-time moms, particularly about pregnancies in general, but also about feeling comfortable to lean on a technology platform?
I would tell first-time moms, try it. Lean on your doctor, because your doctor's still going to be there. The doctors weren't telling me you have to use the app. They are there. We're not going to lose touch with the doctor. But a lot of people, like Dr. Demosthenes said, that a lot of moms are working, and so having an app to take your blood pressure at home cuts out that appointment. So that is really helpful for first-time moms. But I was really glad to have it as a second-time mom.
Yeah. Is that similar, Dr. Demosthenes, is that a similar experience that you've had with first-time moms using the platform too?
So absolutely, it's not limited to people who've already had a baby, but I think another thing to emphasize is that we want to give women choices. So we don't want to just say everybody has to do this. We want to offer them what might work best for their situation, and if somebody wants to come in every single time, that's fine, but that's just not the way women operate in this day and age. They want a little more flexibility and control, and we want to be able to provide that.
Anish, what is as we wrap up this session, if you could leave us with a parting word on what we need to pay attention to from Babyscripts in the future, what would that be?
No. First of all, how awesome has Aiden been?
He's the
coolest
coolest
asleep.
kid.
He's the coolest kid ever. I think the point that I made earlier about we need to do as a system, as a country, a better job of taking care of our moms. Things are particularly worse if you are African American or a mom of color. There's a lot more there. I think ultimately, as a company, our goal is to improve the standard of care, working with providers and patients, keeping that whole journey and experience in mind. And we're very thankful and honored to have that privilege.
Well, I want to thank you all so much, and let's please give a gentle round of applause so we don't wake Aiden. Thank you all so much.